Colleen Parsons with part 2 of head, face, and neck for your assessments. So we are looking at inspection, palpation of the head, face, and neck. There isn't really much. There's a little bit of auscultation involved. So when you're inspecting the head and neck, you sort of inspect and palpate simultaneously, which probably makes sense to you. So you would begin by looking through the person's hair, feeling their scalp, asking if there's any pain or discomfort at all, looking for bugs, and if you need some information about lice, we can talk about that in class. You're looking for symmetry. Symmetry is the most important thing. You're looking for any protrusions or abnormalities. You don't do a complete inspection per se, like searching every inch, because that just, hopefully they already know if something's not right for them. But you are going to feel for the temporal mandibular joint, because that's where TMJ is. So you're going to have them open their mouth and close their mouth to see if you can feel that click. You're going to notice their facial expressions, how their face moves, and the symmetry, if there is any abnormal swellings, if there is any abnormality in the way they move their muscles. When it comes to inspecting and palpating the neck, I really want to impress on you that you must, as new nurses, use the posterior approach, at least as far as I'm concerned. There are only a couple times where you won't use the posterior approach, so remind me to explain that in the classroom. But for now, you want to stand behind the patient, and it is best if your patient is a little bit lower than you are, like you see here in this diagram. Don't use the anterior. You're just not experienced enough to know what that feels like and to do it with your thumbs. So come behind the patient and palpate the trachea. Is it midline? But you're going to be doing that also from the front to see if it's midline, and you're going to be palpating the size of the thyroid. Then you're going to come around front and you're going to be auscultating that, and I think there's a slide on that here in a second. You're looking for symmetry and range of motion. Is the neck supple? Does it move easily? Is there any resistance on the person? And if you put resistance and ask them to push forward, can they push your hand out of the way? Can they push against your hand and actually move your hand, or don't they have any muscle control there? You absolutely need to know all of your lymph nodes, and you need to know them just like they are here. So 1, 2, 3, 4, 5, 6, and this is really how they flow in the lymphatic system. 6, 7, 8, 9, and 10. I don't think your skill sets ask for the supraclavicular lymph node, but it's good to know it anyway. Do not vary your sequence because you may miss some of the small nodes. There's a bigger picture, and that should help you study, and you do have access to this in your book, and you also have access to this slide if you need to print it off in the lecture material. That's the end of part 2.